Okay, so we're live. Hello, everybody. Thank you so much for being with us at our webinar today. So this webinar today, it's co-hosted by MedMastery and Consensus, and we have a super interesting topic for you. So today we're going to speak about AI for evidence-based clinical answers. So we're going to show clinicians and researchers how you can use AI for supporting clinical decisions, for teaching, and also for academic research. We can go to the next slide already.
Cool.
Okay, so just to introduce myself, my name is Noor and I'm a medical doctor. I work at MedMastery as a special projects manager. And yeah, nice to see everyone here today.
Awesome. And my name is Daniel. I lead the growth and partnership side of Consensus. And so for context, Consensus is an AI search engine for finding research papers. It's used by over 1 million clinicians around the world to help them make it faster to be able to search for medical research and guidelines. And we'll kind of show you a bit more with the platform and explain more as we go on. But yeah, excited to be able to meet you all.
Yeah, so thank you guys for being with us today. And I just want to let you know how you can use this platform that we're currently on. So to the right of your screens, there's a chat box. And that's where you can say hi and get to know us a little bit. And then beneath that, there's a little question mark icon. So if you guys have questions throughout the webinar, please make sure that you submit it in the little question mark icon so that we can organize the questions a little bit.
Cool. And just a quick disclaimer before we go into this, Consensus and any other AI tools are really here to support your decision making. And so none of these tools, Consensus or any other ones, are meant to make decisions for you. At the end of the day, you are the expert. And so kind of what we're going to be highlighting is how a tool like Consensus helps you make decisions faster by helping you find relevant research faster. And so again, a lot of these tools, like they're there to help you make decisions and not necessarily make the decision for you. And so at the end of the day, you should use your best judgment as a clinician in the decisions that you're making, and Consensus and any of these other tools are just there to help you make those decisions faster.
Yes, exactly. Thank you, Daniel. So before we go ahead and start the webinar, we want to know from our audience, how do you guys usually find the most up-to-date information on your clinical questions? So are you guys using any AI tools or what methods do you use right now to find? So just let us know in the chat. Okay, so some people are saying PubMed, ChatGPT, Open Evidence,
Up to date,
Amboss.
Boss. Cool, I haven't heard that one. A lot of up to date. Perplexity, Open Evidence, Mayo Clinic, Palm ER up to date.
A lot of people are saying up to date, actually.
Oh, nice. Got a few consensuses already.
Yeah.
Hail
Well,
that.
in this webinar, we'll be teaching you how consensus could help with this.
Yeah, and
Okay, so thanks, guys.
I'll explain the difference as well as you kind of get into this. But yeah, maybe Nora, if you want to start with this, and then I'll explain. Yeah, I'll explain about consensus, how it differs from a lot of these other platforms, and where it can be helpful.
Yeah, so we want to know, so how does an AI-based approach differ from traditional literature searching?
Okay, awesome. And what's great is like in the chat, I can see a ton of different like a variety. So I can even tell like some of you are definitely a bit more on the research side. Some of you are definitely more on the clinical side. And so yeah, I'll explain a bit about how consensus kind of approaches this, and I'll also generally explain I think some of the core differences between the platforms because you'll see a lot of similarities, but it's really important to know where there might be differences. And so right off the bat, a tool like Consensus uses a traditional and more modern version of search. And so most of you are familiar with kind of classic search, which is keyword search. That's what you see when you use PubMed, when you use UpToDate, a lot of other kind of more traditional platforms. You type in a disease or a question, and it's able to return research or case reports or guidelines that have that disease or question or the words that you searched in the actual research paper. Now, this is great if you know exactly what you're looking for. A lot of the times, you kind of do, but you're also looking for other papers. And that's where this kind of modern search called semantic search comes in, which not just looks at keywords, but it also looks at similar concepts. So, for example, if you were typing in the name of a disease, semantic search is able to return papers with that name, but also other papers that may be actually talking about the exact same disease, but with a different name, or with a disease with a very, very similar pathology. And so what that results in is being able to retrieve more relevant searches. And a lot of the doctors and clinicians and researchers that use consensus actually mentioned that there's papers here that they missed, that they didn't see on PubMed or they didn't see in other areas because of the way that the search works. And we've actually run a number of studies with third-party clinicians, like completely blinded, and we found that consensus retrieval actually, that's in PubMed, by around 6% on average. Sometimes it actually goes much higher depending on what you're looking for. But a lot of it was because of this semantic search, which is able to retrieve papers that you as a researcher or you as a clinician may not have actually expected, but may actually find quite useful. And so that's kind of one of the core parts just about the search. And then the second part, of course, is the AI summarization. And that's where the real value comes in helping you make decisions faster. Also, I see Caleb had a comment. I love consensus for how accurately it cites the sources. My biggest threat with other LLMs. Yeah, huge point. Thank you for that. And I'll kind of explain exactly why that's happening. And so on the summarization part, this is where the real value comes in, because not only is it able to return papers, but consensus is actually able to read through those papers for you. And so it reads both the abstract and the full text if it's available. And then it provides a summary of those papers and links you to the papers directly. So the part in which it helps is if you've ever been in a scenario where you are, trying to make a decision quickly and you need to understand what the research says, but part of that decision is that you have to go and now do a lit review, right? You've got to go search, you've got to go read through 10 to 20 papers, figure out which ones are relevant to your population. That's really where consensus can help, because something that would take 30 minutes, an hour, multiple hours can now be done in a matter of like 5 minutes with consensus. And that's what we hear a lot from clinicians that are using us, is that it helps them make those decisions faster because it's able to find them the relevant research and the relevant points from that research very quickly. And so just to give you a sense, consensus is now used by over 1 million clinicians and researchers across a variety of institutions. And I've just put some of the logos on here that I thought might be relevant. So for example, Mayo Clinic, a ton of the researchers there use consensus, MD Anderson, ETH Zurich. I know there's a bit of Europe, there's some folks from Europe as well, Texas A&M, McGill, University of Michigan. There's actually over 100 universities and top tier research centers and clinical research centers in the US alone that use consensus, and broader, it's actually used by over 10 million researchers around the world. So this 1 million is actually just very, very specific for clinicians. And one thing that's super important, and this is really where the difference between like a tool like Open Evidence or UpToDate and consensus comes in, is the best way to think about it is Open Evidence is kind of like an AI UpToDate, very focused on guidelines and practical applications. Consensus is like an AI PubMed. And so we really focus in on the research side. So where we found a tool like consensus being particularly valuable is for clinical researchers and specialists. So anyone who actually needs access to research. So if you ever find yourself on PubMed needing to look at research for a topic, that's where consensus comes in. And the reason why it kind of, it's better on that side is we have a giant index. So we have over 220 million peer-reviewed research papers. So this is basically everything on PubMed, almost everything on Google Scholar. And in addition to that, we also have exclusive partnerships with the largest publishers in the world. So that's Sage, publisher of Nature, Nature Health, a whole bunch of other journals, Wiley, the APA, and the list goes on. And this gives us exclusive access to the full text of the actual study, many of which are paywalled, that we can use in the search. So when we're searching for papers, we're actually able to read through the full text and provide ones that are most relevant. And so that's where this starts to lean, is that, again, you can think of consensus like an AI PubMed. You can think of Open Evidence like an AI UpToDate, which is more focused on kind of practical and guidelines, whereas consensus has guidelines, but it also has a lot of research. And so that's kind of where the difference is, if you're kind of looking and figuring out which is a better tool for me or which one makes more sense to use. And also, feel free to drop questions in the Q&A as we're going through this. As we kind of do some of these live demos, we'll take these questions as they come up. And so please be active in the chat, be active in Q&A. This is really for you. And so we're happy to kind of dive into any of the areas that you're interested in.
Yes, guys. So we have like an open Q&A in this webinar. So whenever you have a question, you can drop it into the Q&A and we'll try to answer it.
Yeah.
So we've
Yeah.
actually thought about a couple of use cases where consensus could be helpful for clinicians. And one of the first use cases we saw, and which was validated by a clinician who used consensus, is supporting clinical decisions. So, what does that mean? That means that if you're in a clinic and you're faced with a rare case, for example, and you want to find a case report which may help you in the treatment plan, this is one of the use cases. So, we've prepared a couple of cases to showcase this. Yeah, so we have a question that we wanted to ask Daniel and see how can AI support specifically in clinical decision making, and
Yeah.
especially when it comes to up-to-date evidence.
Yeah, so I'll kind of reiterate kind of what we just chatted about. So this is it, like where AI supports clinical decision making is in helping you find the relevant research fast, and also helping you find the insights from the relevant research that are relevant to your actual problem fast. And so we're going to go through a couple of different cases, and I'm going to show off different parts of consensus. But a couple core parts to know are one is, the first one we're going to show is when you ask a question, how it's actually retrieving the papers and how it's summarizing that information. Then we're going to show in a second one how you can actually modify how the information is presented. So you can ask it to create tables, show you visuals, really customize a response in a way that actually helps you make a decision. And then we're going to go into a couple of other use cases. But again, it's really about one, finding the research, and the second one is being able to extract the information in a way that actually helps provide you an answer extremely quickly. And I also saw a couple of other questions. So consensus read through papers that are not open access. Yes, it can. And I'll show you how to tell if it read through a paper when you click on, when we actually go into the case. And then again, how is it different from open evidence? See a couple of upvotes there. Think about consensus like an AI PubMed, and in open evidence like an AI UpToDate. So consensus is has a much wider research-based coverage and has exclusive full text access to a wide variety of different papers from the publishers. So if you ever need to go to PubMed for anything, think about consensus. And if you are constantly just going to UpToDate, open evidence. So more practical, consensus is more focused on the research side.
Okay, great. So let's go ahead and start with our first case. So this is a case that actually happened and where a clinician used consensus to find relevant case reports. So let's say that you're faced with a 70-year-old patient. They have an infected knee replacement, and they also have paroxysmal nocturnal hemoglobinuria. They're currently using Bapalta, and one of the risks that the clinician was worried about with this patient is because they were going to get operated on for their infected knee, they were at risk for hypothermia, which can lead to hemolysis in PNH patients. So let's see what kind of prompts this clinician would have put into consensus and what the results were.
Awesome. Cool. And so we're going to actually go and hop into the tool. And then while I do this, I'll also just put the link to consensus in the chat here. Consensus is free to use. And so anyone can go on, ask a question, get results. It's free to create an account. And then I'll kind of explain there is like a pro version that has some more powerful features, and I'll explain what that is. But anyone can go and get started on consensus pretty quickly. And so here what we're going to do is we're just going to go ahead and go to consensus. And so I'm just going to share my screen here. So this is the actual consensus platform. And so you might see it look like this, where it says research starts here. I'll just explain a couple different parts. So if you're not signed in, you'll still see this exact same screen, but history and some of these things might be hidden. So creating an account is completely free. You can use Gmail, whatever you'd like. But the core thing there is it saves a lot of your searches, so you can go back and see them. You have a library and other aspects. But the core functionality of the platform is very much the same. And so right over here, you see a search bar. This is where you're going to be putting in your searches. Over here, you see filters. So we'll explain that in kind of like some of the other ones, but right away, this allows you to filter for when papers are published, right? So you can, I saw a question there about limiting it to recent research. This is a great way to do that if you want to index on some of those things. Consensus also does this automatically, and I'll kind of show you what's happening when we run the search. But if you really wanted to like fine tune control over the research that's being study, there's a whole bunch of filters here. There's the published year, journal ranking, methodology. So you can actually filter for specific, RCT trials, case studies, etc. You can even look at countries. So let's say you're focused on a population in, I don't know, somewhere in Europe, let's say, or let's just use Brazil, for example. You can check this mark, and this will actually only filter to studies where the subject population was in Brazil. So you can get very controlled here with how you look through research. But again, that's just an option if you want to do that. What I wanted to show you, because I think this is probably going to be relevant for most folks, is if you click on sources here, you can see all, which is the entire index of over 200 million papers, and that's kind of all research across all different topics and studies. But if you click on medical here, this is actually going to prioritize and pare down the journals and the articles to ones that are highly rated medical journals and guidelines. So you can think about this as if you just scoped it down to PubMed or like other kind of guidelines or up to date, for example. If you click on this, that's what this will do. And you can see here that the title changes to medical research starts here. So we kind of built this for clinicians as we find that a lot of clinicians, were focused on human studies and they wanted more guidelines. So we built this, which is kind of like a curated source of research for them to return more relevant results. So let's go ahead here and actually put in the case itself, which I've got over here. So I'm just going to copy and paste this in. And so the question that we're going to run here is, I have a patient with PNH, which is treated with Fabhalta. They have an infected knee. An operation is planned to treat the infected knee. What strategies must be in place to prevent complications during the surgery? So you can notice here a couple things. Number one is that I'm asking this question the same way that I would ask like a colleague a question, right? I'm not trying to figure out keywords. You just need to type it in the same way that you would ask someone. And I think the important thing is, what are the things what are you actually looking for from this? So in this case, I'm really interested in strategies. So let's go ahead and hit run here. And you'll notice that Consensus is going to do a couple things. So the first one is it's actually going to figure out on its own which search queries are most relevant to be able to return papers that can answer your question. So when you're asking questions, you don't need to think about how to structure the search. Just type it in as you would talk to someone, and Consensus will do that work for you to figure out what it should actually be searching for. The second thing, as this kind of like loads up here on the top, and I'll explain the AI section in a bit, but if I scroll down, you can see that Consensus, right, already has found a number of papers that are like quite relevant to the question being asked. And if I go here, there's a couple different ways to look at these. There's like this kind of condensed mode here. But if I switch it to table mode, you'll see what's going on behind the scenes. Consensus pulls the paper, and it's able to actually pull a bunch of information. So it's able to see where the population was, the method, the results, the outcomes. And using all that information, that's when it generates the AI overview. And so first thing it does is it takes your searches and it figures out, in this case, it's run 4 searches in the background and then aggregated the most relevant papers. Then from there, it'll extract the information from those papers, and then it'll provide you an overview. And so if I scroll up now to this top section, you can see that Consensus has given me a pretty solid overview of the research on this topic. So right at the top here, it's focusing in on key issues. So it's found that key issues are hemolysis, thromboembolisms, and infections. And then under each of these, it's going under like all these different topics that we chatted about. So
yeah, so it's showing different strategies to prevent hemolysis during surgery, basically.
Yeah. And what's great is that as we're going through this, if I go ahead and you can see all these citations are in line here. So if I go ahead and hover over a citation, so number 13, for example, I can see here that this is the actual paper. And if I click on this, this will actually pull out the paper in the sidebar here. So now I can go ahead and read the abstract, or something really helpful is I can click snapshot, and this will provide a study snapshot. So right away I can see like who the patient was, what the sample size was, what the location was, methods, outcomes, results. So let's go ahead and maybe click on this one here. I can see it's going to do the same thing, right? So now I can see the patients are slightly different, smaller sample size, outcomes, and results. And
so this can quickly show a clinician basically what the paper is about, right? So that if they want to learn more, they can look at this first, basically.
Exactly. So this is like kind of like a pre-screening. So if you find that a paper might be relevant, what you can do is if you just click on this bottom part here, it'll actually open up the paper directly. So you have direct access to the papers. Now, there was a question around, how do I know that the Consensus read through the entire paper? And that's where you can see this check mark here. So in the sources, you can see right here, this one has a little check mark and it says use full text. So in this case, the paper was either open access or we have a partnership with a publisher, and Consensus was actually able to read through the entire paper to be able to provide a result to you. Some papers, maybe we only have the abstract and we'll tell you that, but for most papers, and you can see here, it's like over 60, 70%, we actually have the full text for it and we're able to go and read through entirely. Awesome. And then one other thing I wanted to show is in terms of, I saw there was a question around, I saw it in the chat, I think, was around how does Consensus balance recency, for example, right? Let's say a paper is published in 2025, but doesn't have many citations. Does Consensus still show that? And the answer is yes. So if I go back down to the papers here that were aggregated, you can see that they're ranked 1, 2, 3, 4, 5, 6, 7, 8. So this is Consensus's rough ranking of how relevant the paper is to the actual question that you asked. Now, the way that it does this is through a couple of factors. The first and biggest factor that it's looking at is the actual semantic relevancy. So is the abstract, the full text, and the title actually relevant to the question that you're asking? That's like about 70% of the ranking is based on that. So it's trying to find papers that are actually related to what you're asking. Now, the rest of 30% really depends on a number of factors. Citations are in there, how recently it was published, the author, etc. But specifically in medical searches, what we found is that many researchers prioritize the recency of publication more than a number of other factors. And so you can actually see how that's weighted in the results here. You can see that in the top 5, 1, 2, 3 of them were actually published within the last year and a half. And so for medical searches, and we kind of do this all behind the scenes, Consensus actually prioritizes papers that were published recency from high-ranking journals as one of their kind of core factors. And again, if I wanted to filter down to the last couple of years, I can add a filter, or I could even just do a follow-up and say show me research only from the last 5 years. And now Consensus is actually smart enough to be able to say, okay, cool, let me take the context from my previous search. Let me go and apply my own filter. So you can see here is filtering for anything above 2019. And then it'll do the same thing of running the search, finding papers all above 2019, and then being able to provide you an answer. And so you can get really... Sorry, go ahead, Mary.
Yeah, I was just saying, so you can either use the filter functionality or you can include it in your prompt, basically, right?
Yes, exactly. You can do either one. Yeah. So you can use the filters themselves if you want that kind of fine-tuned control right at the beginning. Or you can just straight up ask it in the prompt. And we'll show examples of more follow-ups as well, because it's not just filters. You can do things like create a table, show me a research timeline, show me where gaps are in the research. So you can get really creative with how you're asking your question. But again, those are those two parts of Consensus. So the first one is actually finding the papers, and then the second one is actually reading through them and presenting that information to you. So it's very flexible, and it gives you a lot of control as you're going through it.
Okay, great. We have a question actually, Daniel. Someone said, if you filter to medical, would it still include allied health professional research, e.g. physiotherapy? Do you know about
good question. I might have to get back on that. I believe it is the best reference method for being able to figure out is if you can find something on PubMed, you'll find it in medical mode. And so I'm not specifically sure about that specific type of information, but you do best. If you can find that information in PubMed, it'll be included in medical mode. If there's something that isn't, so for example, you want maybe non-human studies or even a wider berth of topics, that's when I'd recommend going to all. And I find that this one is actually really helpful for researchers because then you can go all and then you can actually apply your own filters too, and that gives you even more control. So if I went all, for example, one of the filters I could apply here, and I believe it's in methodology, is I could look at human studies only. And so now you can think about this as a much wider berth, right? It's not just looking at top medical journals and guidelines, it's looking at all research, but you just filter it down to research that only focuses on humans. So that'll give you an even wider berth, but it might include a lot of things like very early clinical trials if they were published, et cetera. So it's up to you to figure out what wide berth. We find that most practicing clinicians or specialists will use medical mode as primary because it's they just need a really quick answer they can trust fast. Whereas researchers tend to want more control over what's there, and so they play a lot more with these filters. So it really depends on your use case, and if it's you have more time to dig into the research or you want something quicker, that's when I'd recommend kind of using medical mode versus all and applying your own filters.
Okay, great. Thank you so much, Daniel. So I would say we move on to our next case,
Okay, cool.
because
Yeah, lots of great questions in the chat though. I'll try to read through
yeah,
these and see which
there's
ones are
there's loads of great questions, but I think a lot of them will be
the
suited
answers. Yeah.
to the cases that we show. Okay, so our next case is this is also basically another case, a simpler case. So let's say you're trying to figure out atrial fibrillation management strategies. You have a patient that's 80 years old, and they have indication for anticoagulants such as warfarin or DOAC. And yeah, you want to see what the most up-to-date research says. So let's go ahead and see what consensus says about this.
Awesome. So I'm going to go
I
ahead
think,
and click on this. And this one we've actually already run the search. So rather than
yeah.
kind of redoing the same thing, we're just going to walk you through a kind of core example here. Awesome.
Yeah, so it resurfaces some studies which show specifically edoxaban and warfarin and what kind of dosages would work best in these kind of patients, specifically when speaking about stroke and bleeding risk.
Yeah. And one thing we wanted to show from here is, there's a lot of information here, but let's say, for example, I'm really interested in what are the treatment options and what are the pros and cons with those. Like, that's kind of what I want to know from this question. So what I can go ahead and do is I've run this search. It's giving me a lot of good information here. And I've even got like a summary table here, populations, comparisons, and kind of outcomes. But I really want to focus on the treatment side. So I'm going to say create a table of, no, was it outcomes or treatments? Which one is more relevant?
For treatments, so let's say create a table of, or create an overview table of
Cool.
the treatment options.
Okay, cool. All the
And I
treatment
think that would
options.
be more comprehensive
Great.
options for the treatment.
Yeah. And I'll just say like, and their pros and cons.
Mhm.
And so this is an example of like us asking a follow-up. And again, I would say there's two kind of core parts to how you can search. One of them is the topic. So kind of being clear with like what you're looking for. And then the second one is what we call a command, which is how do you want the information to actually be presented to you? And so in this case, I've given it a clear command, which is like, great, I want you to create a table of all the treatment options and the pros and cons. And consensus is actually able to then go through all of the results that were formed, and then provide again that table to you of here's strategy, here's the main pro, here's the main con. And what's important is that it again links all of those actual citations in each row of the table. So you can actually go and see like where exactly was this treatment used and where is this information actually coming from. And let's say, for example, I'm going through this and I see a paper maybe that might be relevant. So, for example, here's one that I think might be relevant. What I can do is I'm clicking into this and I say, okay, cool. This is about the population I'm interested in. It's about an older population, and I want to know more about this specific paper. What's really interesting is in consensus, you can actually click into a paper. So let's go for this one, for example, and I'm going to ask it more details. I'm going to say, tell me about the population used in this study. And this is where consensus becomes really valuable because not only can you do these broader searches here, but you can actually zoom in on specific papers and ask it questions about those papers too. And if we have, again, the full text for this, which we did, you can see that it's able to provide you answers. And it's actually able to show you exactly where, like a quote from the actual paper that it found that information in. And so consensus allows you to, not just start off, and in this case, I'll kind of show you the whole flow where we started off with a broader question to understand, like, what does the research say on a topic? Then we dug in even more and we said, hey, I want you to create a table showing me the overview or the outcomes from here. And then we found a paper that was interesting, and we dug into that paper specifically. And I can also you can dig into multiple papers. It doesn't have to be one. You can add 3, 4, 5, and then say things like, can you compare the different populations here and the different outcomes that the treatments resulted in? And it'll be able to zoom in on those specific papers and show you a lot more about the paper itself. And so, yeah, very useful to be able to, again, start broad and then dig in. But this is a good example of if I were to do this on my own in PubMed or in UpDate or other research tools, This probably would take me at least an hour, if not a bit more, to be able to do the initial search, screen through papers, pull out the information, find the papers that are interesting, and then dig into them again. And we've done this all within a matter of like 5 minutes, including me explaining it. So there's quite a bit here.
Okay, thank you so much, Daniel. We have a couple of questions. I say like we address one of them before moving on to our next section.
Yeah.
There's one question which is about hallucinations, which I think
Ooh,
is
yeah.
quite interesting. And
Yeah.
it states, I experience hallucinations when querying specific Korean pharmaceutical brand names. When I
Mm,
admit, I sometimes intentionally prompt this to test the limits.
yeah. Great
However,
question.
given that these hallucinations do occur. Yeah.
Yeah, this is
How
a
do
great
you
question.
guys deal
And
with hallucinations?
yeah, and this is something I think you should test out with all the AI tools you use. And actually, this kind of highlights the biggest difference between a tool like Consensus and let's say ChatGPT or Perplexity, for example. So, um, in most AI tools, you can think about them like a chatbot first and a research tool second, where these chatbots like ChatGPT, Perplexity, they're trained on a bunch of data, and what they're trying to do is they're trying to answer your question with what they're trained on. If they determine that a search needs to be done, they'll do a search and then they'll just use some of that information to supplement the answer that they want to give you. And the problem with that is that's where hallucinations come out because it might give you an answer on something where, the source material isn't actually accurate on that. It might be out of date. It might not even exist. And so the biggest complaint that we hear, especially from researchers and clinicians using ChatGPT, Perplexity, et cetera, are that they spend almost as much time as they've saved using it, double checking that the sources are actually legit or that they exist. Huge problem, especially for medical professionals. Now, with Consensus, it's actually the opposite. So Consensus is a research engine first. So what it's doing when you do a search is it's first doing a search to figure out, are there actual published research papers or published case studies that discuss this topic? Only when it finds that information is it then passing it to say, hey, let me summarize this information. So if you type in a disease that does not exist in Consensus, you won't get an answer. It will say there was no research found on this topic. And again, that's because it's doing the search first and then it's providing the answer second. So if there's no research about that topic, it won't provide you an answer. It won't even try. And so that's one of like the core guard against hallucinations that we have is that again, everything is tied back to an actual published study. And then the second one is that we have a whole bunch of other checkers that check to make sure that the information being displayed is actually coming from the papers. And we kind of try to display that throughout the product. And then I think the best example is like when you dig into a paper and you hover over it and you can see exactly where in the paper it came from. We try to embed this throughout the product. So we're not trying to answer something for you. We're trying to make sure that we can point you to the right paper as fast as possible. And so I would think about that as like kind of the core difference between Consensus and another one. Again, it won't make up something. It'll only be able to provide you research about that topic and summarize what the researcher is already saying and then link you to that research.
Okay, great. Thank you so much, Daniel. So let's go ahead and actually speak about another use case that
Awesome.
consensus can be used for clinicians.
Yeah,
Yeah,
actually,
sorry.
Nanor, I see a couple questions about free versus pro, and so I think it might be good just while I'm here.
Mhm.
So on the free plan, and let's just go like back to home here. You actually have access to everything in Consensus on the free plan. The only difference is that very similar to other tools, some of the more powerful features like Pro or Deep are limited monthly. So, for example, you can get 15. I believe you get 15 searches for free each month, or 3 deep searches for free each month, and then Quick is unlimited. Quick is kind of like a smaller summary, so it just looks at the top 10 papers and it's a bit lighter. Pro is what's most commonly used. That's the one that has all the commands that you can go into. But again, you do get this for free on the free plan. The pro plan just gives you basically unlimited access to a lot of these searches.
Yeah. And if you guys stick around till the end, we actually have an offer for um, the pro plan of consensus.
Awesome.
Okay, yeah, so we just wanted to mention also that there are different functionalities in consensus which can be used specifically for team-based discussions or even for medical educators. So yeah, we wanted to show those and we've prepared a case. If you go on to the next slide.
Awesome.
Yeah, so let's say you have a patient with alcohol use disorder. They have cirrhosis, and you're in a team discussion about possibly using naltrexone. And nobody really knows what the new evidence says about it. And so you go to consensus, for example, to search this question.
Awesome. Yeah, so this is another great use case. And so again, this one is more focused on like the teaching and discussion side. And so I'll actually show a bit. There's something there in consensus. There's actually a whole bunch of built-in visualizations that make it very easy to be able to consume the research and also discuss it with peers. And so in this case, we have run the search, and one of the visualizations in consensus is called the consensus meter. And so if there's a clear yes or no question, either in your question or that it can derive from your question, it'll present this meter to you. And what this actually does is it gives you a sense of, of the research that it found that had a clear outcome, which of them leaned yes, possibly mixed or no. And so in this case, it's very clear that a lot of the research shows that it does appear safe and for this use case. But you'll find, like, if you ask other questions, you might find the research actually mixed, which ends to leading to some interesting discussions on which populations are impacted, in what use cases is it yes, in what use cases is it no. But it's a really good starting point, especially for team discussions around the effectiveness of certain treatment plans, outcomes, et cetera. And again, all based on the actual research. Another one that's quite interesting, and I'll kind of show down here too, is you can do stuff like, can you show me a research timeline on the research and when it was published? So there are a number of different visualizations. There's actually another search I'll show you a bit later that has everything. But you can do things like look at research gaps. You can ask it to create timelines. So here it's actually creating a timeline of the research that it ranked and showing you kind of where it leans. So a lot of the research is very much leaning more recent versus, I can see one that was highly cited from 2004. And so this is also a helpful discussion. So when you're doing your searches, you can also get a sense of, how spread out is my research. And so this is an example of one. You can do a research gaps matrix, which actually shows you a cross section of the research and where there might be research missing. So it's quite helpful, especially for discussions. These visualizations are all ones that have come directly from researchers that they've kind of asked us about. And another thing is that it's very easy to share searches and consensus. So for example, if I go ahead here, I can copy this link and I can actually just put it in this chat and anyone can go and access this. So if you put this in the search bar, you actually get the search thread. So you'll get this whole thing that I see here. And what it does is it kind of copies it into your environment or your login or your account. So you can actually now run your own searches on this, and this won't affect me. But it's a great way to be able to start off on a topic and share it with someone. To say, hey, check this out. Maybe we can, either split up this research, or this is a good starting point for you. And then finally, you can also export. So over here, I can export as a PDF. And what this does, and I've kind of got one over here already, but it actually exports like a PDF report of the answer. And so it gives you the question, the answer, and then also gives you all the references down at the bottom as well. So again, great to be able to send this to colleagues, to residents, to other researchers on your team as like a really good starting point for discussion or even overview of the research itself.
Okay, great. Thank you so much, Daniel. So I'd say we move on to our third and final use case of how to use consensus for clinicians. So this one is probably the biggest one, and it's for academic research. So Daniel's going to tell us a little bit about specifically the features of consensus, which are specifically used for academic research.
Cool. Yeah, so this one is a bit more like obviously with researchers, and I can see like there's some good questions I'll address here. So like Paul's got one in the chat around uploading PDFs and analyzing them. So I'll kind of dive into this, but the biggest group by far that uses consensus is researchers. So clinical researchers, like I see a question on veterinarians. Yes, it really covers a wide variety of topics. And so if you're a researcher, there's obviously a much deeper flow that you're going to. You're typically diving into a topic, you're exploring everything around that topic, and then you are doing a study, writing a research paper, et cetera. So you're kind of looking at it like a funnel. Whereas, if you're a clinician, if you're a specialist looking for an answer, you're looking for data that supports your answer, and then you're moving on to a new use case. So it is slightly different. We have a lot of really core use cases for researchers in consensus. But just to give you a sense of where consensus fits in the research process, if you think about it into three parts, like the first part is your understanding what does the literature say in a topic, and that's kind of everything we've shown so far. The second part is you're like, okay, now I'm saving papers, I'm digging into very specific areas. And the third part is kind of review and synthesis. Consensus really fits in the first half. So it's really effective for being able to find relevant research. And then I'll kind of show you some more ways that you can dig into the research as you get into this middle portion. Before we do that, just a reminder too of like where these papers are coming from. So Consensus has 99% coverage of Q1 journals. So you can think about this as, again, everything in PubMed and almost everything in Google Scholar. We also have partnerships to fill any access or areas that we don't have. So for example, we have partnerships with Sage, Wiley, Taylor Francis, the APA, ACS, a number of, and the list kind of goes on of very, very large publishers that gives us access to other papers that may not be covered, as well as full text of paywall papers that we can leverage in the search. And the last thing as well is, again, there's filters, which we talked about and showed, that give you manual control over this. And so let's go ahead and go into this prompt. Now I'm going to show you a feature called Deep Search, which is really relevant for researchers because it's almost like a deep literature review. So I'll go ahead over here. And so, oh, I didn't know I'm sharing this.
Can you tell us what the difference is specifically between the Pro and the Deep Search?
Yeah, great question. And so when you do a new search thread, so if I go here, on the bottom left, you'll see a couple different options. So there's Quick, there's Pro, and there's Deep. And depending on the plan you're on, you might have different amounts. So for example, the free plan has unlimited Quick, 15 Pro, and then 3 deep searches a month. The Pro plan has unlimited Pro search, and I believe about 15 deep searches. And then this is more of like if you're with an institution, or there's a plan called the Deep plan, which has way more deep searches. And so the difference between these is you can think about Quick like you just want a fast answer. It'll analyze the top 10 papers. So it's very useful when you're like, hey, I just want a quick yes, no, I want a quick overview of what the research says. Pro is the one we've been showing so far. So it analyzes the top 20 papers and gives you, these tables, these visualizations. It's much more in depth if you really need to look into the research. And then Deep, you can think about like a literature review. So I will actually I'll just quickly run a new Deep search in this tab, and I'll show you what's going on, and then I'll just show you the complete because it does take a few minutes to run. So I'm going to go ahead and run a deep search, and you'll see what's kind of going on. So when I run a deep search here, you can think about it like a much more intense pro search. Like if you were to run like 50 pro searches at the same time. So what it's doing is you take your initial question, it does the initial search for you, and so you can see here it's kind of applied its own filters to it, and then based on the results that come back, it generates an entire search strategy. So let's just collapse this here. And so you can see here that Consensus has kind of, based on these results, is determined all of these different subtopics and areas to go and explore and do research in. And so you can see here, it's going to clarify the evidence-based. And so here are the different questions that it's asking. So it's really digging into reviews, meta-analysis, directly addressing SSRIs and suicide risk. Yeah, over here, it's going to be rephrasing for terminology. It's going to be contrasting findings, expanding filters, background theories. It's even going to do a whole crawl of all the citations in the key papers to make sure it didn't miss anything. And what that does, and you can see here, is that it's already identified 350 papers. And this number will continue to go up to 1,000. And then it'll actually screen down those papers. And then from there, figure out which ones are most relevant. And then it'll give you an in-depth report on the top 50. So I'll just skip back over to a kind of completed report here. And you can see, again, same thing. It went through all these steps. It found 230 papers that were highly relevant to my question. And the report that I get is much more in depth. So this is a much more powerful search. It's kind of like, when you think about the research function on ChatGPT Pro or other, it's kind of like that, but only looking at peer-reviewed research. And then the actual overview is much more in depth. So you can see here, like, it's referencing way more sources in the answer. So I can see like 34 just in this intro section. Good example of a consensus meter where the results might actually be split, yes and no, depending on the type of case. I've got, an overview of the search strategy that it did here. We got like a results timeline of all the papers that it found. So kind of those visualizations I was sharing earlier, top contributing journals, authors, claims and evidence. So what are claims across papers and how strong are they, depending on the studies and the number of, papers that actually focused on them. This is the research gap. So where is the research missing? So, again, this is more for researchers, but this gives you like a very in-depth review on a lot of associated research around a specific topic. So this is the deep search, and you can follow up on a deep search. You can ask follow-up questions in any search mode. So what I've seen people typically do is start off an exploration in deep mode, And then you can ask follow-up questions in quick or pro, whatever you like. And it has all the context from like all the papers that it searched. So it's a great way to kind of start broad and then narrow down as you like. And again, you can also share this with other people as well. So great for discussions, teaching, or researchers. Another aspect I wanted to show for researchers, and I saw a question here about like libraries, about uploading
Yeah.
papers. Yeah, so you can upload papers in consensus. So I can upload them either right into a search, so I can see upload here, or I can put them in my library. And as I find papers in consensus that are interesting, I can also save those papers to my library, to a collection, to a sub collection, and kind of manage all of my research there. I can even save threads, like whole research threads, to my library. And when I come into my library, you can see here, I've actually got a ton of papers. So I've got like 344 papers here. You can upload papers. So if you have PDFs, you can upload them 20 at a time. And we actually just released this integration with Zotero as well. So if you are using Zotero, whatever, you can actually connect it to your Zotero library and import all of your papers. So we have researchers, like we released this last week, and we've already had researchers that are importing libraries of like 20,000, 30,000 papers in the consensus. And where this is really helpful is that all the same searches we did, you can actually even do those on your library. So if you have a library of papers already, and you just want to search your library, that's where you can do something like this. So I can say, show me research gaps matrix of the papers that I've collected around muscle building in athletes. And now consensus and what it's doing is because I'm searching the library, you can see over here, it just says my library. So it's only looking at the library. And it's running the search now just on my library. So this is really helpful if you've already got a collection of research and you want to be able to analyze it. So you can do, you can find papers that you remember about. In this case, I'm doing something specific. So I'm actually looking at a research gap. So I'm saying, hey, I want you to analyze my library and tell me where research is missing. So I can see here, like, oh, I'm missing tons of research in these specific areas. And then I can even do something that's pretty cool, which is like, I'll remove the library. So I'm going to say, hey, look at all papers. And I'm going to say, for all, I'm going to say, find me papers that fill these gaps. And now consensus is going to use the gaps from my library, and it's going to run searches to figure out and find papers that are missing from my library. And so again, extremely powerful for researchers. And there's a ton of different use cases here that you can put in, but it kind of, in addition to the actual searching consensus, the library aspect almost becomes like your personal research assistant with all the stuff that you've collected over the years.
Okay, great. Thank you so much, Daniel. So I say let's take a couple of questions for 5 minutes before we conclude the webinar.
Yeah,
So
absolutely.
one of the questions says, how does DEEP decide on the relevance of the papers?
Yeah, good question. So it's the same thing, the same relevancy that we discussed before, right? So if I go into the section here, and you can see here, it found all the papers that were like gaps. Consensus is doing a couple things. So the first one is depending on your like 70% of relevancy is like semantic relevancy. So how relevant is the title, the abstract, and the full text to the actual question that you're asking? So if I go back to, I know you asked a question about deep modes. If I go back to that search I did here, and I scroll down to all the papers that I found here, it's again very looking for papers that are like hyper relevant to the question that I'm asking. So that's 70% of it. The other, and you can see it's kind of ranked. So what consensus will do is it will basically try to rank them based on that relevancy. So you can see it's ranked from like, this is a deep research, so it'll rank from like 1 to 50. But other ones like the one we ran earlier will rank from 1 to 20 because they're pro search. So that's a big part of it. And then the second part, which is about 30%, is like a combination of citations, recency, the actual journal. If this was like a reputable journal, like a highly reputable and ranked journal, who the author was, if they published papers that are similar, there's a whole bunch of other factors that are incorporated that result in the relevancy ranking. And then the way that you can kind of control if you want to weight certain ones more is you can either tell consensus, hey, like, prioritize papers in the last 5 years, or you can actually go and apply filters to have it kind of filter down those results as well. And so that's how the relevancy ranking works.
Okay, cool. let's look at the other. I think a couple of them were already answered. There's one question that says, how does consensus country-specific medical disease? So I guess when you're looking up evidence on country-specific diseases.
Ah, very interesting. So one thing that consensus will do as well is, and you can kind of see here in the information that's abstracted, is that consensus also is able to know, and it'll try to pull this out of the paper if it mentions it specifically. But consensus will also be able to pull out like which country that a study was focused on. And so if, for example, you know that a disease is a lot more prevalent in a certain location, you can actually, where is it? Oh, here, countries. You can actually like indicate the countries that you want to limit the research to, and this will limit it to the research from that specific country. But like if there's a disease that's related to a specific country or is highly prevalent in a specific country, you can still search that normally. I just assume that most of the papers that will be returned will likely be from that country since the disease is relevant there. So I'm not sure if I understand it fully, but you can also filter for specific countries, and that will limit the research down to research that again has focused on populations in those countries.
Okay, great. Not then there's another question about duplicate citations.
Great
So
question.
how does Mhm.
Yeah. So consensus actually does handle duplicates. So you like every single source in consensus is linked to like an actual research paper with an actual DOI number. And so in this case, you can see that every single paper is linked to a DOI number, and that's how we ensure that each paper actually exists and that they're unique in nature because they have a different DOI. Um, it would be pretty rare for the same paper to be published under two different DOIs. That would be like kind of like a broader issue. So that's how consensus is basically deduplicating. It is again every citation here is linked to a specific DOI, and then you can also see here that that's part of our search as well. So in deep, where it's running like multiple searches, so let me just refresh here. Yeah, in deep search where it's running multiple searches, you can actually see here where part of what's happening behind the scenes is it is removing duplicates. So if it's running multiple consecutive searches and it sees like, okay, two searches return the same paper, in your final consolidated result, you'll just see one of those. You won't see like the same thing referenced four times. So it is actually handling those and merging basically the results from multiple searches to give you one unified list of the research papers.
Okay, great. And then I'll say we'll take like one more minute to answer one final question before we conclude.
Yeah.
And that one is, how does consensus handle newer studies that aren't widely cited?
Yeah, and again, this goes back to how consensus weights information, and so you can see here actually in this one about naltrexone safety and cirrhosis, the top result is actually a paper that was recently studied or recently published with zero citations. And so depending, like again, going back to the relevancy ranking, number one is it's looking for if the paper is highly relevant, and then the second one is a number of those factors. And this all kind of happens behind the scenes. But for medical research, we've specifically kind of weighted it so that recency is a core factor, like it's prioritized in the ranking. And so you will actually see in a lot of searches that consensus is really good at surfacing papers that were published recently. They may not have many citations yet because they were published, but they might actually be ranked over something like, in this case, you know, published in 2022 with more citations. And you can see actually here, a case report, 2025, 4 citations. And again, it's determining A, that this is actually relevant to the question being asked, and then B, it's recent, it's legitimate, and so it's also prioritizing journals that have high impact ratings. So you want to know that it's good science or it's published in a reputable journal, and then those other factors. And so there's a wide variety of factors that come out, but I would think about it as prioritizing like highly relevant research that is recent, that is from a legitimate source, that you can then utilize, especially in medical searches.
Okay, great. Thank you so much. So I say we go ahead and conclude the webinar. Daniel, could you go back to the presentation? Because I had a slide
Yeah.
just about med mastery. So wait, let me just remove this question from on screen. Okay, so I just want to let everybody know about Med Mastery before we conclude. So Med Mastery is a platform which offers video-based courses on essential clinical skills. And so we call ourselves like the Netflix of medical education because once you have a subscription, you get access to loads of video-based courses. And this includes things such as ECG, CT, MRI, mechanical ventilation, and much, much more. So in case you're a clinician and you're interested to enhance essential clinical skills, make sure you check us out after this webinar. And with that, you can go, yeah, great. So with that, we actually have a special offer for everybody who's attended this webinar live. And so we have an extra 30% off of MedMastery Pro. And together with that, so if you purchase the MedMastery Pro subscription, you get 1 free year of Consensus. So you end up saving quite a lot of money. And all you need to do is use the code below, which is AIWeb426, and you click the link below. And yeah, this offer is valid for the next 72 hours. So make sure you get it. And I think also, yeah, Daniel already explained the differences between Consensus Pro and the free version. So in this case, you get a free year of it together with MedMastery.
Yeah, and again, just for anyone who didn't catch that, Consensus is free to use, so you can get started. Go ahead, try it out. You get access to all the search modes. Some of the more powerful ones, like Deep and Pro, are just limited on a monthly basis because it does cost to run those. And so when you go to the Pro version or the premium version, like you see here, that one actually includes unlimited Pro searches and way more deep searches. So my recommendation would be like start using it, try it out. If you like it, that's when you know, okay, I'm going to be using this a lot. I can upgrade. And then this deal is a great value as well because you basically get the entire year of Consensus Pro for free with your kind of MedMastery subscription. And then if you are already a MedMastery subscriber, actually, I believe Noor also has there's another discount.
Yes, exactly. So if you're already a MedMastery subscriber, we're going to send you an email after this webinar where you can get 30% off of Consensus. But also the 30% off of MedMastery Pro is a lifetime discount. So yeah. Awesome. And then we can go to our next slide. So we would love to hear from you how you would rate this webinar from a scale from 1 to 10. There's currently a poll to the right of your screen. It should be live. And yeah, just let us know how useful you found this webinar. We're always open to feedback, always open to improving. Yeah, so thank you so much, guys. We're going to send you an email after this webinar. You can use the same link to watch the replay. So make sure you watch it, make sure you share it with your colleagues. And yeah, thank you so much, Daniel, for all of the information.
Yeah, thanks so much for having me. Thanks so much, Noor. And hope to see you all on using Consensus. You can always message us as well. We really take feedback into account. That's kind of how we've grown so much in the past couple of years. But thanks again to all of you, and maybe we'll do more of these if you find them valuable.
Thank you so much. And if you guys like this webinar and also want to collaborate with us, just reach out to us. We'd be really happy to discuss. Thanks, guys. Thank you, Daniel. Bye.